In this video then we're going to be looking at the skeleton, and we're going to start looking at the bones. So you'll see up here you need to know the names and locations of the bones in the body. So we'll start by looking at the skeleton, and you can see on both pages you've got this word bank down here. So what I suggest you do, let's make a start by pausing the video and see if you can label up this diagram of the skeleton yourself, and then we'll come back and have a look. So pause now. Right, we're going to work our way from the top to the right hand side on this side first. So hopefully you will have established that the skull is the cranium, and you'll notice there I said the skull. We need to make sure that we're not using the common terms. So if you look here, that is the spine or the backbone, but we need to call it something else. But let's carry on going down here. So on the right hand side here, it's not massively clear, but it's actually pointing to the common term is the shoulder blade. So the shoulder blade is called the scapula. Then the spine, as we talked about just a moment ago, is called the vertebrae. And then this small bone here in your shin is called the fibula. And sometimes some of my students struggle with this. What's the difference between the fibula and the other bone? And to help them, certainly it helps me in terms of my understanding, is the fibula, I think of it as being a little fib. So this bone here is small. So fibula, fib is a little lie, isn't it? It's a little fib. So I just connect the two together. So fibula is the smaller of the two bones, and then the other bone, we'll have a look at what that is in a moment. But coming up over here, we've got this really big long bone. It's the longest bone in the body, and this is called the femur. And then you have these two bones in the lower arm as well, and potentially they cause a little bit of confusion as well. So hopefully you remember that this bone on the outside here is called the radius, and the way that we remember that is that the bone radiates away from the body. So radius is on the outside, and the other bone, which we'll look at in a moment, we'll obviously work out is on the inside. And then this bone here, it's where the ribs join, is called, the common term is the breastbone, but we call it the sternum. So that's what you need to know, the sternum. So that's our first set there. Let's pop over to this page and finish this off. So we'll start up over here. I think this long bone here is called the humerus. Then you've got that other bone in the lower arm, and this one is underneath, and it's called the ulna. So the way in which I help my students remember that is that the bone that's underneath is the ulna. Next one there, hips, and they are referred to as the pelvis. Then we've got the big long bone here, and so obviously remember that the small one is the fibula. This one is called the tibia, and they go together. So it's the tibia and the fibula there. And then down here again, it's not a brilliant image to be fair, but there's a connecting bone in the ankle which is called the talus, which you need to know. Then you can see the kneecap here. This is called the patella, and pretty obvious, hopefully you know what this one is. These are the ribs. So those are the bones that the exam board AQA expect you to know. I just want to draw your attention to two other sets of bones as well before we move on, and that's these short bones we refer to in the hands and the feet. So I haven't got these marked up for you, but you might want to make a note that these small bones here, or short bones here, are called the carpals in the hands, and the metacarpals are these tiny little ones here, and the ones at the very end are called the phalanges. Now you don't need to know this necessarily. I don't expect you'll be directly examined on it, but it's important for you to be aware, and you'll see why in a minute. So these short bones here are carpals, and these short bones here are tarsals and metatarsals. And as I said, I'll explain where they fit in just a moment. So that's our overview of the bones. Now, in terms of being examined, yes, you might get a question that asks you to label up the skeleton. If you do, hopefully that will be relatively straightforward. You'll feel confident doing that. But actually, what you really need to know is this point here, which is that you need to be able to identify the bones at the following locations. So you need to make a note that you should know what bones are at these locations and joints. Again, remembering that it's bone, so it's not just one bone. So what I suggest you do is, again, pause the video and then go through that, and I'll run through it with you. So the head and neck then, the two bones you can see are the cranium and the vertebrae. The shoulder is the scapula and the humerus. So the humerus is the long bone here. The scapula, remember we said, is the shoulder blade. The chest hopefully you're okay with that, is the ribs and the sternum. Remember, the sternum is the best breastbone. The elbow, you've got 3 bones going on here joining. So we've got the humerus, the radius and the ulna. The hip is the pelvis and the femur. The knee, femur and tibia. Remember, tibia is the bigger of the 2 bones in the lower leg, and sometimes you might see the patella included in there as well. But if you don't remember the patella, that's fine. But femur and tibia certainly you need to mention when you're talking about the knee joint. And the ankle has 3 bones, and they are the tibia and the fibula and the talus.